I'm here with Peter Chang. Peter gave an interesting talk on tube shunts, on trials going on now, and on what is in the pipeline for us. Now, I don't do tube shunts. I don't. I'm scared of blebs. So, tell me, lay out this topic for us, and particularly the Ahmed versus Bervell trial, and then I want to talk about what's in the pipeline.
Yeah. So there's been ongoing sort of debate about Ahmed versus Barvelt or valve versus non-valve tube shunt in glaucoma surgery. So there was actually two very large multi-center randomized trial prospective called ABC and AVB, and they had enough similarities that the investigators actually combined the database to look at the outcome. And what they found is it confirmed actually a lot of what we already kind of understood to be, that the Barvelt, having the larger surface area, was able to give a little bit lower pressure, lower IOP at the end, greater pressure reduction, and less dependency on medication. But as expected, had a higher risk of hypotony complication that the valved Ahmed implant was able to provide.
So has the finding made from these studies changed the way that you practice?
It really has, actually. Having trained at Bascom Palmer, I was primarily trained with Barvelt. And with these outcomes, I'm actually using more valved Ahmed implants, especially in patients where I think they're higher risk of hypotony. And some of that includes very elderly patients. I think we understand that aqueous humor production naturally diminishes as people age, and I think very elderly patients are higher risk of hypotony with the tube shunt. So I'm more likely to use valved Ahmed shunts in those patients.
Now, our palette of tube shunts is going to soon grow. Let me get you to talk about what's in the pipeline for us.
Yeah, so in fact, there's a new non-valve implant from Ahmed that's just been approved by the FDA. So, we've sort of associated Ahmed with the FP7, which is the most commonly used valved implant, but now they have a non-valved implant that's been approved by the FDA, both in the similar size as the Barvelt of 250 and 350 square micromillimeters. And then there's also really exciting newer sort of hybrid implant, if you will, coming out from Centene, which purchased the InFocus microstent. And the new name's going to be pressure flow. And it's really a hybrid in the sense that there's no big reservoir plate, and it's able to be done through a very small conjunctival incision, much like what Express was being done. Mm-hmm. But there is actually a tube that is inserted into the anterior chamber to prevent scarring.
Yeah, interesting stuff. Where do you, this is not a fair question, which is of course why I'm going to ask it. Where do you think these new devices will fit into the sort of clinical space? Well,
I think the shunts are still going to be further beyond what we're doing with the MIGS, obviously. I think MIGS still have that safety value that these implants don't have as much. But I think with the pressure flow or InFocus microstent, it's a nice sort of a bridge between the MIGS and the full-blown tube shunts that will allow a shunt device to be performed through a much smaller conjunctival incision than what we're used to with the traditional tube shunts.
Peter, this is cool stuff. It's always fun having new things to do. I want to thank you for making what is, for me, a very complicated topic very clear. And, of course, for being so very generous with your time with us today.
Thanks for having me.